Hi, this is Dr. Ross Cutts, and you're watching my video on an immediate dental implant placement. So this is the poor root that's broken and needs to come out. You can see there's a little fragment, and because it's got a favourable root form, we've discussed with the patient to put an implant in straight away. So we just use a small little instrument to wiggle the tooth root out carefully. And we just, with a pair of tweezers, just take it out very simply, straightforward. And then I always like to just map the socket to check that we've got bone everywhere, there's no residual infection. And then use a little pilot drill, which I find as part of the Straumann BLT kit, and then the 2.2 drill. And I'm just following the extraction socket in this case. We can see a little bit of residual GP, which I'll just remove in a mo. That's our first direction indicator. So we're checking angulation, looking for a screw retained crown to be made. This is the 2.8 drill, and we're going to place a narrow BLT implant here. Sometimes we then need to, so we use a short drill followed by a longer drill, just to ensure we go to full depth for the osteotomy, which is going to be a 12mm implant. Check the angulation again with another direction indicator, which is showing good positioning. That's our implant of choice, the BLT SLA Active 3.3 by 12mm bone level tapered. I always like to put these in by hand, so first with a shorter driver, screw it in, and then with a longer driver and the torque wrench, we can just fix it in place. Take off the driver, check the angulation again, check the positioning, check the depth apicocoronally, and then I just like to seal it up with a little biomaterial. In this case I've used Max Resorb, which is a fully synthetic. So take off the carrier and see we've got a little gap between the implant and the residual socket. I put on a rather large healing abutment in this case. It helps to get a good plug, and then I just pack a little bit of biomaterial just down, and this really is mainly to stabilise a blood clot. So we know we're going to get a bit of remodelling of the extraction socket, that's a physiological fact, and just pack it down the side, nice and straightforward. As I said, just to stabilise blood clot. And that's our BLT implant in place.